Hey everyone, it's Misty again, 11-year nurse who lost her job after finding out she has a PNPLA6 disorder, mutation disorder called Boucher-Neuhauser syndrome. So today I'm going to talk about cerebellar atrophy. There is not a lot of information regarding cerebellar atrophy on this app, TikTok, or any other app that I've seen. So I'm going to talk a little bit about it, about symptoms and how it affects me personally. So I have a computer right in front of me. So if I keep looking down, it's because I'm referring to notes. Because of my mild cognitive impairment, it's really hard for me to kind of stay on track. So your cerebellum is a part of your brain that tracks or helps control balance, coordination, and motor skills. When it begins to shrink, also known as atrophy, it begins to lose cells. It impacts the body's ability to execute precise, smooth movements. So it causes ataxia. So that's I personally, with my ataxia, I walk or ambulate with a wide-based gait. I also kind of veer to one direction or the other, and it's really hard for me to walk on uneven surfaces. The other thing it causes is poor coordination. So I personally have difficulty with fine motor tasks. I'm really clumsy. So I found out, as a registered nurse, as I was trying to get the pills out of the package for my patients, I would drop them, flick them across the room. Another thing I also noticed is that I couldn't put my patient's gown on. I was having a hard time buttoning them. So anything that has to do with fine motor skill movements, even like using chopsticks is really hard for me, and even using silverware is hard for me as well. And when I say it's hard for me to use silverware or chopsticks, I mean it's hard for me to grasp the utensil. I usually don't hold it hard enough, and I tend to drop it, or I just can't use it precisely. And even with using chopsticks, I have to use it in a whole different way that's not even used. But in order for me to use chopsticks, I have to place the chopsticks in my hand a whole lot more different than people usually do. Another thing cerebellar atrophy causes is nystagmus. So I have what's called gaze-evoked nystagmus, and that's when I look to my direct gazes, is when you start seeing my eyes beat. Okay, and I also have what's called downbeat nystagmus, and you can't really see that unless you're trained, because it's a very fine movement, so where my eyes just kind of tick downwards. So as a nurse, it was really hard for me to count my patients' breaths per minute because I couldn't see it. Like my vision kept, oscillating and switching around and stuff. So cerebellar atrophy also causes something called dysarthria, and that's when you have slow, slurred, or imprecise speech. So it's very hard to tell with mine, but I will mumble and I'll slur, and sometimes I can't control or I don't really realize my pitch of voice is either too high or too low. But a lot of the times my sister will tell me, like, what are you saying? Like, you're mumbling. So, but one thing I do have is when the neurologist tells me to follow their finger, I will do it exaggerated. Like I'll miss the mark, exaggerating, where she's going. That's what I have. Another symptom is vertigo, and that's persistent dizziness. Another symptom is dysphagia, and that's trouble swallowing, or you cough when you eat, or have to constantly clear your throat. But yes, your cerebellum helps control the muscles and stuff to help you swallow. If you have issues with trouble swallowing, it can also lead to aspiration pneumonia, and that's when food and oral fluids go into your lungs area, causing pneumonia. Another secondary complication is diplopia, and that's double vision, self-explanatory. The other one is hypotonia, and that's decreased muscle tone or floppiness. I have not had this symptom yet. Another one is, the last one I'm going to talk about, is cognitive issues. So mild cognitive impairment, or in some progressive cases, dementia. So I have mild cognitive impairment. So mild cognitive impairment will give you disruptions in executive functioning, language processing, visuospatial skills, and emotional regulation. So it affects your working memory. And then you have poor cognitive flexibility, as in, like, it's really hard to multitask, or set shifting, like switching in between tasks. Some language and linguistic difficulties is decreased verbal fluency. So I'll struggle to generate certain words. I'll also struggle to remember certain words. And it's also really hard to explain myself in a logical, cohesive manner, unless I have like notes or something like that. I also have something called mild anomia, and that's trouble finding the correct words during spontaneous speech. And also I'll have some mild grammatical errors. And so I also have visual spatial disorganization. So I'll have difficulty conceptualizing and accurately copying complex shapes in geometric drawings. I don't really have that, but it can happen. There's also something called impaired visual spatial memory, and that's forgetting the layout of familiar places, or losing track of objects in physical space. So that's really bad for me. If it's not out and I don't see it, I forget about it. Okay, so like I can go to the store and buy like a delicious treat that I love to eat, and if I put it away in a place that I don't remember it, I'll forget it's even there. The affective and emotional changes are emotional blunting or apathy, a flattening effect. I don't really have that. I can have that, but I'm very expressive in facial expression and speech. Altered mood regulations. I will cry, even if I just think about how much I love my sister, I'll just start crying. It's crazy. I'll cry over cartoon characters, just anything. So sudden mood fluctuations, that definitely happens to me. So those are a little bit of my symptoms of cerebellar atrophy caused by the PNPLA6 gene mutation and disorder, of which I had called Boucher-Neuhauser syndrome. If you have any questions or comments, go ahead and let me know. But yeah, that's a little bit of me. Thanks.